The country of Somalia is located on the northeast horn of Africa. It has a population of around 10 million, with dual official languages of Somali and Arabic. The most common religion is Muslim.
Seattle has the highest concentration of Somali refugees. Many of the refugees came to this state as a result of war and education.
Education is one of the two greatest challenges for Somalis in Seattle, the other being employment. English proficiency measured in 2010-2011 cites that English proficiency is directly related to family income level. There's a roughly 40% speaking proficiency among African American children of immigrants. However, this number decreases by 5% if the family is below the poverty level.
Looking at the chart that we present here, at the educational social determinant of health, one can see that African Americans pale against other demographics. There are 4 known keys to college and career readiness that are widely used by Washington schools as a goal for K-12 completion. These include content knowledge, cognitive strategies with synthesis of materials, learning skills, and changes in knowledge. The essential link between all of these key components is the ability to read comprehensively and write effectively. Literacy is the foundation for all efforts and achievements.
Currently, the Washington State Bilingual Education Program offers services to students who are learning English as a second language. Most of the Somali-speaking children in Seattle utilize this program.
Seattle's school system assesses English language learners and enrolls students in English assistant programs. The troubling fact is the overall achievement levels among these students have only improved 2% over several years, and 8th grade reading proficiency declined between 2006 and 2007. There is a lack of data from English language learners in more recent years.
Education is a way out of poverty. At the same time, poverty is a barrier to higher education opportunities. There's a correlation between parent education level and a child's academic success. For children of Somali immigrants, their parents, who have not had formal education attainment themselves, are unable to provide them with support and guidance in coping with the challenges.
The association between literacy and health is well known and documented. Health literacy refers to tasks such as reading prescriptions, appointment cards, medication labels, and directions for home health care. For Somali families, the added complication of language barriers, cultural barriers, and inexperience with Seattle healthcare systems create other obstacles at each stage of care.
Recent studies conclude that increasing health literacy and elevating educational goals among members of low socioeconomic status results in improved knowledge and compliance with medical therapies and motivation to act on personal empowerment. For Somali immigrants, empowerment and participation would positively impact health outcomes. Increasing health literacy and by using health skills programs in K-12 schools would empower children to have confidence and ability to navigate America's health system. This would have a two-part benefit by also promoting healthy lifestyles and habits within their tight-knit families.
In Washington State, 25% of patients served were speaking a language other than English, making health literacy more important than ever. Nursing needs to attack issues on cultural assimilation, language, and literacy. A collaborative approach is needed with public schools and Somali coalitions. Targeting emotional needs and literacy needs is also essential.
We propose a program that begins when a student tests into bilingual language learning. The ESL teacher would be approached and asked to allow the student to participate in supplemental English coaching that includes aspects of physical and psychological health skills. Our target audience would be the Seattle Public School District, Somali Community Services Coalition, as well as healthcare providers caring for children and families.
We would call it Health Skills. This program would be held in a group tutoring format that would be held during an intermediate hour after school is out. The main goal of Health Skills would be to help support and teach coping skills to children at this susceptible stage of life. The program would include confidence-building activities, encouraging children to gain knowledge and skill in familiar areas. For Somali children in K-12, this might include traditional games, music, food preparation, and demonstrations of family responsibilities.
Agendas of health skills. Teaching respect and care for one's body, such as hand washing and dental care. Getting a buddy system with fluent English speakers that bridges cultural values. Volunteers, outside funding, strong coalitions, and public school cooperation is definitely needed for sustainability.